So today we're going to talk about permanent lip procedure. These are reminders and tips before we show you how to do it using your machine and your pigments, because there are important things you have to remember before this procedure. So what are the facts about permanent lip procedure? Okay, so permanent makeup is a modern form of cosmetic tattooing. We use a different machine that is shallower, and we also use organic or safer pigments compared to the old style of cosmetic tattooing. Okay, touch up is required about 45 to 60 days after the permanent lip procedure. Full color may take more than just one treatment because after your first procedure, you may only have around 60 to 80% adherence or lower. So application of permanent makeup can be uncomfortable depending on your client's threshold, so we recommend using numb creams. Pigments can and will fade because permanent makeup procedures are just shallow, and as skin refreshes, the color goes away in time. So pigments can heal differently than the color you applied, as you can see in the photo. When you apply the color, it seems too strong or very saturated, but right after your peeling, around the fourth day, the color will seem to go away. But this color that faded is just a response of the skin. The skin will either lighten or hypopigment, or it will darken or hyperpigment. And usually this response happens right after the peeling and can last to up to about a month. So a month after your procedure is the best time to judge how much color adhered. Okay, so there may be immediate or even delayed reactions to the pigment. So in our previous lecture about the risks of permanent makeup, we have discussed how to know if your client is allergic to something, and also how you are going to make the client sign a waiver to make sure that they know the risks of permanent makeup. So patch testing is recommended at least 48 hours before the procedure. If the client doesn't want to go or have patch testing done because they want the procedure done right away, it should be in your waiver that they waived patch testing. However, even if you do patch testing, it doesn't guarantee that your client will not have an allergic reaction after the full procedure, because some reactions are very delayed. So it's really important that you have your waiver. Okay, infection may occur with clients poor following of post-care procedure. It's important that your client keeps the work area clean, because the lips or the mouth has a lot of bacteria, because that's where we eat. Food, remains of food causes bacteria formation. Saliva causes bacteria formation. So they have to keep the inside of the mouth clean very well with antibacterial gargle. And the work area, you have to give them topical antibiotic. These can be bought in sachets so that they can apply it after the procedure. And they have to keep the work area generally clean. Allergic reaction to anesthetic or antibiotics may occur. We have discussed this in the infection prevention lecture. You may go back to it in case you forgot some details. There will be slight swelling and redness after the procedure, definitely. The lip tissues are quite sensitive, and swelling is a natural after effect of the procedure. This can be helped with cold compress or ice packs. Clients receiving permanent lip procedure who had previous cold sores or fever blisters may have an outbreak following the procedure. So if your clients know that they are prone to cold sores or they've had fever blisters in the past, they can talk to their doctors first and ask for permission before having the permanent lip procedure done. Some doctors require the patient to undergo a round of antibiotics for this cold sores or antiviral medicines for their cold sores. It depends on situation, on every person's situation. So it is best that if your client is prone to cold sores, they have to check with their doctors. You will see scabbing on the skin surface, similar to a natural body response when you get a wound. This happens within a week or shorter. Sometimes on the fifth day there are absolutely no more scabs, but it doesn't mean that the lips are healed. It could be tender and thin, and it might be prone to infection. So the treatment or the caring should continue even after the lips have fully peeled. Okay, so again, warning on the cold sores. Okay, because you introduced wound on the lips by trying to put the pigment in, so cold sores might happen. So as I've mentioned earlier, a healthcare professional might prescribe an antiviral or an antibacterial medication before having the procedure done. We do need to stretch the lips, but we don't want to put too much pressure when applying color because it might cause bleeding and bruising. Can also cause the lip color to be darker than what the client has requested. And finding the right pressure is key, and experience will teach you this, but you can test with your pressure. Stretch a little bit, apply a little bit of pressure. If you see that the color is adhering with your first few strokes, that means you got the right pressure. If you see that the color is not adhering at all, then that means you need to make your pressure a little bit stronger, and you should also make your stretch a little bit wider. Okay, there's what we call color theory for lip color, because around 90%, regardless of race, have cool or blue undertone in the lip area. That's why when we feel cold during winter time, our lips turn a little bit blue or maroonish because of this cool undertone. Even though you have a warm facial undertone, the color of your lips might be cool. And to be safe, we want to counteract this coolness by adding a little bit of orange color to help neutralize the color that can come out from the blue undertone. Because as you see, we have to go back to our color theory training. If you put cool red or pink on the lips that has blue undertone, too much coolness might result to the color being bluish kind of red or darker, even purplish. So we want to counteract that by using or by adding a little bit of orange on the shade that you're going to use. Adding a small drop of orange to the mixture should not change the color that you're trying to achieve. If you put too much orange, then the color of the pigment you desire to use will not show properly. So adding orange it should make the color warm, but it should not change the color. So you have to test how your color or your pigment will react to adding of the orange. Some cool lip colors are those that has this name, like mauve, pinks, red blues, plums, fuchsia, magenta. These are colors that have cool undertones, and these are the ones that you might want to add a little bit of orange to. Exception to adding orange. Why? When are you not going to add orange? If your pigment is already warm, it is already based from orange, then there's no need to add orange. You would hear names like warm red or orange red or red orange. Obviously already has orange in the pigment. But this depends on the branding of your pigment manufacturer, so it's always best to ask them if your lip pigment has a warm or cool undertone. If you hear true red, it's a universal color. There's no blue or orange in the colors, so this one might be safe not to add orange anymore. If the person has very warm undertone already, when you see the person, it's already orangey, most likely you don't need to add orange already. So you have options on color style nowadays. Back in the 80s, actually, the trend is only to put around the lip line and keeping the inside lighter. Now we call that more ombre. So with ombre, your outline can be darker than the rest, and it tapers and goes lighter until you reach the middle. Making it lighter in the middle makes the lips look plumper. That's why some clients prefer to have this type of color. There is also what we call the opposite of ombre, of this ombre style that you see, wherein the inner is darker than the outer. With this type of lip style, you just add more passes on the areas that you want to appear darker, and just keep the inner areas a bit lighter. But some do mix a little bit of skin tone color in the inner area to make it look more light. So there's a little bit of artistry combined with the technical know-how of how to do your permanent lips. The most common one that we see or hear nowadays is lip blushing, meaning you apply color all over the lips with a very soft look and with one tone only. Implanting color can be challenging if you don't have the right implanting stretching techniques. So it's important to know how to stretch the lips properly, but not to stretch. As I've mentioned earlier, you have to find that right balance. Lips are sensitive, so implanting of color should be fast. We will show you in the videos after this how to properly implant color. Keep your client comfortable by having your topical anesthetics near you, so when you need to reapply, it's easy. You have to outline the design that your clients will agree on. Remember, when you already have anesthetic on the lips, sometimes the lines of the lips cannot be seen anymore because the lips became paler. So you guys have to draw on the lips and design it and have your clients approve your design. You have to make sure you're using a skin-safe marker, one that is intended for cosmetic tattooing. This will be your guide. Before you implant your color, you have to agree on the design. And here are the photos we're showing you how we do our numbing. Okay, first we apply a numb cream. It's a cream type, and we massage it around the lips, especially in the cupid's bows because this is where the nerves are, and the corners because the corners are quite sensitive. And then we wrap it with a cling wrap or saran wrap to warm up the anesthetic and be absorbed by the skin. After a few minutes, say 15 minutes, we remove the cling wrap and apply a lip patch. Lip patch is a form of topical anesthetic as well. The availability of this depends on your country. Some countries do not allow it, some countries do. You can purchase this from Amazon. So this is what you call a lip patch anesthetic. Some brands call it lip moisturizer or lip mask. But the point is, it helps in the numbing of the lips. So after your 15 minutes of cream, remove the saran wrap, apply the lip patch, and then put the saran wrap back so it will heat up all of the numbing materials inside. Now, what about the needles? Nowadays, there are more modern needles that are not available like probably 10 years before. So we have this new Asian style, fast technique or movement, and for permanent makeup machine companies, they either have it in 11U, like this one. That means it's 11 needles in a shape of a U, or some companies have it in 9V or 12V. So instead of a U, you have a V, which is more pointier here on top. Okay, so you will see in our videos how to use this 12V or 9V. So we have an American technique of cosmetic tattooing wherein for the lip liner or the edges of the lip, they use round needles. So you can use 5 round needle with circular and side-to-side movements, slow movements. With Asian style, it's fast movement because of the number of needles that they have. But this style is slow movements with side to side. And then in the inside, you have up and down movements from the outside of the lips to the inner area of the lips. Again, this will all be explained or shown to you in the video of how to do the permanent lips. Okay, and then the European technique, which is also quite new nowadays, is using a 1R needle or a 1 round shader needle. This one yields a lip blush look, meaning it's very soft and very natural. Okay, how do you start a lip procedure? So following your guideline, you start from the middle of the lip and you work your way going towards the outside of the lips. Okay, when you're implanting color on the cupid's bow, you have to stretch it oh so lightly because you don't want the shape of the cupid's bow to go away and you're gonna get confused how your cupid bow really looks like. So start from the bottom and then go towards the sides to complete the liner, and then you work on the cupid's bow without stretching it too much. When your client is lying down, it's difficult to get a true picture of how this cupid bow really looks like. So be careful when you stretch it so that your guideline or the actual design of the lips doesn't go away. After a few passes, you see some colors already implanted. Okay, so you can actually have your client sit down if you want to make sure you're still in the proper guideline that you drew the first time. Wipe the lips often. We use petroleum jelly or any similar product as the lips tend to bleed a lot, and then the petroleum jelly wiping will help the bleeding become lesser, and also it will help you see the true color that is being implanted on the lips, not the one that is just sitting on top. Sometimes you think you already have a good adherence of color, but after you wipe properly with the petroleum jelly, you see that there's not enough color and you need to go back to that area. So remember, the slower your movement, the denser the color will be. That's why in lip blushing, we don't really recommend very slow movements because we don't want the lip color to be very opaque. We want it to look more natural. So this one really depends on what your clients want to have after the procedure. If they want to have that very permanent lipstick look, then go ahead and do your slow and denser movement. But if they want lip blushing, we stay fast movements with more repetitions. If you can work on the lips and if it's adhering well without being too heavy or too slow, it will be better because it will not overwork the lips and it will not be as swollen as it would be when you work on a slow and heavy pace. Okay, so you have to find that balance between fast and slow movements. Okay, check the absorption of the color. As we said earlier, we don't want to keep going back to the same area where color has already adhered so as not to make the lips swell so much. Okay, after the first few passes, your clients might feel a little bit of pain already, so you have to have your during procedure numbing cream. But this picture that you see here is what we call is one of the brands of lip patches that we use, and I've shown you earlier how to apply it. But this one, if you use it on top of your numb cream, I assure you it will be a long time before you would need to have a during procedure numb cream because this is very effective. And also inside every pouch there's a little bit of liquid left, so that liquid will also serve as your during procedure numb cream already. Sometimes the swelling happens and it's hard for you to be able to put color in. So you want to work fast on your lips, in a sense that working smart, that if you already filled in a color in this area, you're not going back to it and putting more abrasions to it. You're moving on to the next part where color is still needed. Overworking the lips by trying to fill them in perfectly during the first session can even cause the lips not to retain anything if it's already very swollen. Just manage your client's expectation. Permanent lip procedure definitely requires a touch-up. Okay, so the lips have the most area to implant color. So usually before you end the session, the lips is already starting to swell. The key is to be able to stretch the lips lightly and firmly, as we have mentioned earlier, and use topical anesthetic so the client will feel comfortable the whole time. Please check your country's ruling about numb creams. Some countries do not allow using of numb creams, especially before the procedure, but allow during procedure numb creams. Okay, so each country has their own ruling when it comes to this. So you have to check with your country's rulings. If you put a mouth guard inside, like this one, this is a gauze actually, it will already help in the stretching of the lips, so you might not need to stretch it so much anymore. Again, reminder, when implanting color over the cupid bows, ease up on the stretching so you do not distort the cupid bow guidelines. And as you can see, this is a U needle, and the way the artist is holding it is 45-degree angle pointing to the inner corners of the mouth. And this one also, another U needle working on the cupid's bow, is also 45-degree pointing to the inner corners of the mouth. This will all be repeated in the video trainings while doing the actual procedure, but I just want to remind you also in this lecture. Procedure healing process. When procedure is finished, you might feel that the color is too dark or too red compared to the desired color of your client. Do not judge the color at this time. Always let your client know that at the end of the healing process, the darkness will fade, leaving a more lighter and softer color, as you can see in this photo. 1 month after procedure. This was her lips before. This was right after the procedure, and this is 1 month after. As you can see, we have about 80% color adherence perhaps. And then the lighter color in the inner part is the only place that actually needs retouching based on the client's requirement, because she wants to have a more natural lip blush effect. But even without it, it already looks like an ombre kind of lip. So even if you don't retouch, it looks decent enough. But we're scheduling her retouch soon. Okay, after the procedure is healed, allow 3 to 4 weeks, okay, for full color result to show. So this is a month after, so 4 weeks. When skin begins to heal, it is opaque in the beginning, and then it will have this more transparent quality. But some clients really want the color to look opaque. They want a lipstick kind of look. So you guys have to discuss it, what kind of effect they want. Okay, you have to provide your clients an aftercare sheet so that they have an idea or they can take care of their lip procedure well. Sometimes color results are too light. Why? Maybe during the procedure, the client's lips are already too swollen because of the numb cream, or you took so much time doing it and the colors already stopped grabbing. Sometimes the artist's hand pressure is not strong enough. Or maybe the client is so sensitive with the pressure or the pain that the artist doesn't want to stress the client so much. So when you do your retouch, you have to do more work. Or sometimes the color is too light for the person's undertone. So a touch-up time, you need a color that may be brighter or darker than the original color that you used. That's why you have to write in your record what color you used, so when the client comes back, you know not to use the same color again. Okay? bottle of color was not shaken well enough because pigments have an amount of glycerin or moisturizer inside. So if you didn't shake it well, most likely when you put the pigment on your ring, it's moisturizer that will come out. So make sure you shake your bottle before you use it, at least for 5 seconds, okay? The client did not take proper steps to take care of the procedure. Again, you may be the best artist. You may have done everything required for absorption, but if the patient or the client did not take care of it properly, when they come back, there might not be enough color in. Like, let's say they make it too wet by applying too much antibiotic ointment. They're diluting the pigment with too much creamy substances. Or they kept it too dry that they peeled a day or two after. So aftercare instructions are very important. Post-procedure reminders. We will be providing you with a PDF form of the aftercare instructions that you can use with your clients, but you are free to edit it depending on the requirements of your country or your own experience. But we will providing you at least a basic information of how to take care of your lip procedures. More importantly, there are things that has to be remembered. Keep away your hands. You only use your hand when applying an ointment, but use a cotton swab to touch the lips. A clean cotton swab or cotton buds. Okay, because we don't want to introduce any bacteria to the lips. No picking, rubbing, or scratching of the scabs. Leave it alone. The scabs will fall off on its own. Just be patient. It doesn't take a long time for lips to scab and peel. Maybe 5 days is more than enough. Cold compress. Here, this is an ice pack wrapped in a clean plastic. You can use that right after the procedure to help with the swelling. You can do it 5 minutes each time. So 5 minutes, cold compress, rest for about an hour, and then another 5 minutes, rest about an hour, as much as you can in the first 24 hours. Because after the 24 hours, the cold compress will not work as much anymore. So within the first 24 hours, that's when you have to do your cold compress. But do not go beyond 5 minutes each time because you will have a cold burn. It's like a wind burn if you put too much icy cold compress on it. So maximum of 5 minutes, rest an hour or a half an hour, and then do the 5 minutes again. Okay, so topical antibiotic is required and should be applied for 3 times a day from 5 to 7 days. What we use is called bacitracin or bactracin, available from Amazon in sachets or packets. So you can give to your client 1 packet after your appointment. They only have to put a little bit. You don't want them to put so much because too much antibiotic will dilute the pigment. Use a straw when drinking and keep away from hot drinks. Straw so that the lips will not get wet. Hot drinks so that the healing wound will not open up again with hot drinks. Okay? Keep away from noodles. Keep away from watery food. So do not bite into a burger or any big sandwich. Food will bleach the color and it might even cause infection. Cut the food into small pieces so that you don't stretch your lips so much. Do not laugh out loud when your lips are healing because that will stretch your lips as well. Okay, so pat dry and never wipe lips when healing. Pat dry because when you wipe or rub, the scabbing might fall off. Keep the inside of the mouth clean by using antibacterial mouthwash. But do that with the use of a straw. Do not wet your lips with the mouthwash or it might be painful. Of course, avoid crustaceans or allergy-causing food or anything you're allergic to for the time being. We don't want to add any allergy issues during your healing time. And drink your vitamins or supplements that promote wound healing.